Thanks for the introduction. I'm just Nugua Makaloga. My English name is Tania Dick, as mentioned. I'm calling in from the Washena Territory, Saanich Territories, and Victoria. I'm going to share with you a little bit about kind of history of my life, my family, being a health professional and being in the health system. This picture here are my parents. They're my mother, Mary, my father, Gordon. They were both taken about ages 5 and 6 and put in residential school as little children. The residential school was St. Michael's, an Anglican-built residential school in Alert Bay, and that opened in 1929. They were survivors of that system. Most of their childhood was spent there. Most of the elements and stuff they carry in their life today is from that experience. I think the last kind of intake of children for that residential school in Numgis Territory was in 1974. So within my lifetime, for sure. So quite significant. It wasn't like forever ago. We tore down that residential school in 2015. I made a point of bringing my mother to witness that. And you can kind of see it in her eyes, the impact, and she was really reflecting and triggered in all of the experiences that she had there. We also made a point of our Head Start program in our elementary school, bringing children down to witness that destruction and remind our children of what we lost through generations past. This is my grandmother. She's a good shooter. She survived the Indian hospitals in Nanaimo. She was admitted and in there for about 7 years, apparently. And after kind of we grew older and did some research, she had about 5 years that she didn't need to be in there, but she was kept in there. So it's just kind of a background information on the residential school, the Indian school, the 60s scoop, all of those things we hear about in the mainstream that directly impacted our family. So this is my parents. They made me and my sister. And fast forward to kind of today, my mother was a nurse as well. The fact that she was able to apply and obtain and get into the UBC School of Nursing in the late 70s, early 80s, coming out of residential school is magic in itself. That's resilience beyond anything I can ever find within myself. She was given, UBC School of Nursing was turned 100 years old last year, and she was given the Centenary Medal of Distinction. She comes from the Red Power days, real strong activist. Her stance was, we need to stand strong for our future generations. What she lived and experienced in residential schools and going through nursing school, she didn't want any one of those following behind her to ever experience it as well. She shared with me some of the experiences in her nursing practice. Some of the kind of racism and discrimination that she faced was kind of pain management, going 6 hours when it was Q2H, but not being able to give them anything because the head nurse said that they were just drug seeking. Families not allowed in, not allowed to do kind of family kind of traditional ceremonies or ways of healing. And then I shared some stories with my mom and talked about my experiences in nursing school. And I was told quite early, well, actually it was about third year in, that I didn't belong here. I need to just go back to my people, even threatened to fail me out of the program. And overall, I think the majority of my semesters, I carried a 4.0 GPA, but still had struggled and was told that I needed to go back to my people. All of my experiences in practice have been in Indigenous communities. That was a conscious effort, really wanting to help and be present and be in the communities. So haven't been kind of subject or experience that kind of racism and discrimination that my mother faced. Was more of an exciting thing to do and people to see me there doing that work. As I progressed in my career, I really got into leadership roles. Became eventually the president of the Nurses and Nurse Practitioners of British Columbia, which gave me a seat on the board of directors for the Canadian Nurses Association, and really wanted to kind of help the profession and bring that Indigenous kind of lens to the both tables provincially and nationally. A lot of great opportunities, a lot of great mentorship, a lot of support, and people lifting me up and bringing me under their wings and mentoring me in leadership roles, but also some really, really significant racist and kind of passive, covert racism. And we hear a little bit, we're hearing more and more about it in the mainstream. We're hearing more stories come forward. Back in 2008, we heard about the Brian Sinclair story of the man who died in the Manitoba-Winnipeg merge from a urinary tract infection to sepsis, going like 17, 19 hours without being properly assessed. We have a personal story within my own family, and the picture of the three ladies there in the middle is my Auntie Deb. That's my mom's sister. She fell, hit her head in the bathtub, and as a result died of that head injury. But the 19 hours she was in care and went across 17 health professionals, RCMP, ambulance attendants. Every single one of them thought she was just a drunk Indian. We had a full coroner's inquest. The results of the toxicology showed that post-mortem blood and urine had no alcohol, cocaine, or any drugs in her system whatsoever. There were 7 recommendations that came forward. About 5 of those 7 recommendations were all revolving around ETOH. So when we talked, you heard Mary Ellen this morning talk about blatant racist comments, and then someone saying, oh no, that's terrible, they're not all drunk Indians, but Indians do drink a lot. So we got the inquest back, and they told us it was a preventable death, non-alcohol related, but all the recommendations were around alcoholism and addictions. I asked my mom what her hopes for healthcare were. She said, we've got to stop talking about this. We've got to have some action around it. We've got to create some change, because this conversation's been going on for generations. We have the tools before us from the past decades, from the Royal Commission of Aboriginal Peoples, the Truth and Reconciliation Commission, this newly released In Plain Sight now. And we need to, the tracks are laid there for us to follow. And I just wanted to take one moment by the end of this that this is my Auntie Shirley. This is my mom's youngest sister. She died last month from an opiate overdose, and was a significant loss for us. And my mom's kind of reeling from it all, but we just got to keep trying, and we got to keep fighting, and we do matter, and we do count. And I just really appreciate the opportunity to share my personal stories. And this is a challenge for all of us to start taking those commission reports, those recommendations, and start breathing some life into them. My hope is that we can stop my people from dying unnecessary deaths and preventable deaths, and that we can increase quality of life. Thank you so much.